I've always known this is a pandemic. I felt it was a pandemic long before it was called a pandemic. We have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine.
Remember, we made a phase 1 trial with SARS, and we never had to use a vaccine. But nonetheless, we are proceeding as if we will have to deploy a vaccine. In other words, we're looking at the worst scenario, that this becomes a bigger outbreak.
And we think we have it very well under control. We have very little problem in this country at this moment, 5. And those people are all recuperating successfully. But we're working very closely with China and other countries, and we think it's going to have a very good ending for us. So that I can assure you.
One of the things that can be done, it's certainly not the total solution to the problem, is to to delay, if not cancel, anything that's elective. I mean, any medical or surgical procedures that need to be done on an elective basis should not be done in anticipation of the fact that beds and equipment that you would use even in an elective situation should be used for people who really need it. Even though you don't see that now in certain locations, pretty soon there's going to be a stress on everyone's system.
Health officials, myself included, have said in the past that travel restrictions are not going to stop completely when you have an outbreak. That is a true pandemic. But I think most health officials agree that at best it delays, and as the Secretary says, kind of pauses things. And that's really the reason and the underlying rationale why that was done. I mean, if there is, and I hope it doesn't happen, a broad pandemic throughout the world, travel restrictions are not going to help. You can't just travel restrict everyone. But I think many public health officials would agree that although it's not perfect that it will stop, it could delay. And what we needed was a delay to essentially prepare better, but also to get a better feel of where this is going.
Now the virus that we're talking about having to do, a lot of people think that goes away in April with the heat, as the heat comes in. Typically that will go away in April. We're in great shape though. We have 11 cases, and many of them are in good shape now. We have it very much under control in this country.
We are reasonably well prepared. We've had a pandemic preparedness plan that we put together years ago. And what the CDC was talking about is taking the process from containment to mitigation. And mitigation means to be prepared to do things that would slow down the spread if we had an influx of infections, such as closing schools, social distancing, teleworking, and things like that. We need to start thinking about that now, even though it isn't absolutely necessary to implement it now.
And again, when you have 15 people, and the 15 within a couple of days is going to be down to close to 0, that's a pretty good job we've done. So I think every aspect of our society should be prepared. I don't think it's going to come to that, especially with the fact that we're going down, not up. We're going very substantially down, not up.
The impact on the rest of the world is still a work in progress. We've seen over the last couple of weeks that other countries like Japan, Korea, Italy, Iran are starting to have community-based transmissions where you have sustained transmission from person to person. That becomes a big threat for the rest of the world, because if in fact it evolves into a pandemic, then every country, including the United States, is going to get impacted.
It's going to disappear. One day it's like a miracle. It will disappear. And I've gotten to know these professionals. They're incredible. And everything is under control. I mean, they're very, very cool. They've done it. And they've done it well. Everything's really under control.
We're dealing with clearly an emerging infectious disease that has now reached outbreak proportions and likely pandemic proportions. If you look at, by multiple definitions of what a pandemic is, the fact is this is multiple sustained transmissions of a highly infectious agent in multiple regions of the globe.
The fatality rate is, of course, controversial because WHO just announced that they think it's 3.4%. You've been, I think, quoted in the New England Journal of Medicine a few days ago as, well, it's probably less than 1%.
No.
Is that, where do you think it's going to end up? Because we don't know the denominator.
But
right?
You said it, sir. If you look at the cases that have come to the attention of the medical authorities in China, and you just do the math is about 2%. If you look at certain age groups, certain risk groups, the fatality is much higher. But as a group, it's going to depend completely on what the factor of asymptomatic cases are. So if you have asymptomatic cases that are a lot, it's going to come down. What we're hearing right now on a recent call from the WHO this morning is that there aren't as many asymptomatic cases as we think, which made them elevate, I think, what their mortality is. You know, as well as anybody, that the mortality for seasonal flu is 0.1%. So even if it goes down to 1%, it's still 10 times more fatal.
And we're prepared, and we're doing a great job with it, and it will go away. Just stay calm.
The system is not really geared to what we need right now, what you are asking for. That is a failing.
And failing, yes.
It is a failing. I
Very
mean, let's
much so.
admit it. The fact is, the way the system was set up is that the public health component that Dr. Redfield was talking about was a system where you put it out there in the public and a physician asks for it and you get it. The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
Early on, we weren't in the situation where we could actually get the tests out in a broad way. And I mentioned on the show last week that we need to get the private sector involved. And just a couple of days ago, we had the CEOs there who are going to be now putting it on full overdrive. So I would expect that very soon. When I say soon, I'm talking about days to a week, where you're going to start to see it go up like this. Not everybody tomorrow is going to be able to get a test, but pretty soon you're going to see a major escalation of capability and implementation.
I've always known this is a pandemic. I felt it was a pandemic long before it was called a pandemic.